could start presenting, and then what we'll do is we'll just reshare for our Cowessess citizens to listen. So it's December the 21st, and we wanted to bring everybody together to talk about COVID-19, talk about the Omicron that's coming, getting closer, and to what we want to make sure that we are well prepared, and really what is it. So Kelly, did you have any opening comments before we start with the actual presentation?
No, I hadn't really planned anything because you said you were going to be the MC or the host. So, and I see Dr. Khan made it on, which is great.
Awesome. Okay, well, I'll be the host. So Dr. Khan, the Zoom floor is yours. We're no set schedule, but we just wanted to make sure that we got some time with you. And for people that don't know Dr. Khan is the provincial lead when it comes to COVID-19, when it comes to making sure First Nation have a voice at the main tables. And Dr. Khan has been an amazing representative. So Dr. Khan, I will hand it over to you to share with us. And if there's questions from the few of us that are on, and then we will be sharing this video again on the Cowessess sites, just to make sure people can listen.
Thank you so much, Chief. Hope you can hear me. Okay, you can see me through the Zoom video, but I actually joined by phone, so hope this would work. So thank you so much, and I'm so sorry that it took a little while for me to join you. So thank you so much for your patience and for connecting again, particularly on the same topic. So first of all, good afternoon, good evening, everybody, those who are able to make it to the call. Yeah, certainly last time when we spoke, the situation was different. This time we're speaking, the situation has changed quite a lot. So in terms of Omicron, where the whole world, including Canada and Saskatchewan and our Indigenous communities are preparing very, very heavily, the situation is changing by hour. So last time we spoke, I think we had 6 cases. Now we have more than 70 cases. And majority of those cases are, first of all, cases are spread out in Saskatchewan. Majority of those cases are in Saskatoon, Regina. And some of these Omicron cases have triggered or initiated school outbreaks. Those schools are online and were closed, but still quite a lot of surveillance, quite a lot of monitoring on that situation. All the cases that I'm hearing so far from the provincial colleagues, so far none in First Nation, so that's a very good thing. But it's just a matter of time. There is a lot of evidence now that it's the community level transmission. We are just not expecting anymore that travel will be the only trigger. It is now in the communities. So certainly that is a change in the state of affairs currently. So most of those cases we are hearing from our colleagues that they are stable. I haven't heard any one of them was hospitalized. I was on call myself on the weekend and I was notified a bunch of cases, but they were all off reserve. And all of them were either symptomatic or very mild symptoms. And some of them were double vax. But majority of those cases which initially triggered this transmission came actually through travel, international travel. So there were travelers from some of those 10 countries that were initially listed, but now travelers from Mexico, from US, from different countries that are not even on the list coming positive with Omicron. So it is believed that the transmission is widespread, but just a matter of time where you detect it. So far, all international travelers coming to Canada are screened for Omicron. But now here in Saskatchewan, wherever we have an outbreak, we will be looking for that. But currently, all travelers coming from international travelers are being screened for that. Also, they're asked to get tested on arrival. They have to have a negative PCR case on wherever they are departing or wherever they are arriving. but on arrival, day 1 and day 8, they are under the federal quarantine, and they will be asked to get tested. So far, in terms of transmissibility, so there is a lot of strong evidence that it is heavily transmissible, more transmissible than Delta. Also, there was a research from Hong Kong about this transmissibility of the virus, and it has a very strong evidence that it is 70 times more transmissible, or more. It replicates itself 70 times higher and faster in the upper part of the lung, where breathing usually happens. Like you breathe out, you breathe in. So if the upper part of the respiratory system is heavily loaded with the virus, then certainly you leave that in the air around you, and that's why a spectrum of transmissibility has been advised, particularly in terms of masking, because initially we thought it was droplet, but now there is an evidence that it can stay in the air around you for a long time. So that's why the advice or the strong recommendation come from PHAC and from ourselves is that we are asking everybody to wear a very well-fitted medical mask. And if you have a high-risk occupation, by that I mean if you are handling patients, public-facing, in a crowded setting, and also high-risk occupation. Also, if you are working in a long-term care facility, personal care home, group homes, for those people, we are strongly advising that you wear N95 or respirator. And those people who have high-risk conditions and go out a lot, out and about, certainly we are also recommending that you wear respirator or N95. But medical mask, a good, well-fitted medical mask would work. And just really putting your mask up properly is perhaps the best you can do. Other than that, there's a lot of investigation and monitoring on finding out whether this does cause severe illness. And from South Africa, where it initially originated from South Africa to UK, London, you guys have seen the mayor of London have said 3 words: speed, surge, and strain. And most of their issues in London, they had to declare a state of emergency because, first of all, a rapid surge and happening in a time where a lot of healthcare professionals are off. I mean, everybody worked day and night throughout the past 2 years. So we were expecting that this holiday season will be a little bit better and nicer and milder. So certainly a lot of healthcare workers, doctors and nurses certainly would like to take off with their family. So not having a lot of healthcare professionals in the system to look after these people, certainly there is quite a pressure on the system, particularly in large cities where there's a lot of in and out traffic. So countries are responding very unusual way. All the European countries, from Denmark, Norway, Germany, France, like all these European countries, came up with very, very dramatic and significant interventions. For example, locking the cities and towns, very dramatic surge in testing, particularly a lot of lockdown restrictions of the mobility of unvaccinated people. And certainly that has sparked lots of protests worldwide. So people are protesting and people are, expressing their opinion. So certainly a lot of strong reactions coming from different countries. But in Canada, we are watching like anybody else. There's a lot of surveillance. In Saskatchewan, we are screening quite heavily. Most of our communities are closed, I think, this week, or some have closed already. But I think in the back of everybody's mind, there's a lot of thinking back, what can we do to protect ourselves? And what can we do to remain vigilant? What can we do in the meantime for a safer reopening in January 2022? So a lot of those thinking are going on, but my advice to you all and to your family is that, of course, everybody wants to protect our families, kids, elderly. Majority of the people have received double vaccinated. By fully vaccinated or double vaccinated, we mean that people have received at least 2 shots. But even that is going to be revised now. CDC is already thinking that the way we define fully vaccinated is that people have received 2 doses, which obviously, when it comes to Omicron, is not enough. You have to have a booster dose, and after that, you can consider yourself you have some protection. It has compromised the vaccine a little bit. There is no doubt about that. But with booster doses around the world, the approach is that booster dose does provide you a little bit of boost in the immunity, and does protect you from hospitalization and severe illness. So I think that is the advice we are giving to the community. So I think yesterday, Genevieve and Laura can share as well their thoughts. But yesterday, we released a video message. And I don't know, Kelly, whether I sent it to you or not, but if I have not, we will send it to you. I recorded a video message on Omicron. A lot of communities are asking, tell us something specific under 1 minute in a video message about Omicron. So I recorded that video message, and it's posted. You can just put that link on your social media or Facebook, and then you would have that message. And there are one other recorded message. So it's up to you. We can send that to you if you want to post it there. But the advice to everybody who are either off or taking off from, closing the office and joining the family, that, the best way to protect yourself and your family is to wear a very well-fitted mask, medical mask, respirators, N95, whatever you have. Particularly if you are going in a place or in a setting where you don't know who you're going to meet or who is in that environment. So well-fitted mask. We strongly suggest that people think very carefully that you just joined, particularly for the New Year and Christmas gathering, that you just joined families, members that are fully vaccinated. Another thing you can do to protect yourself and your family member is to have a very frequent and rapid use of rapid antigen tests for your family and for your gathering. If you are planning like a specific family gathering, that you test everybody, and then you can socialize with them. Having access to rapid antigen tests, respirators and masks made available in the community to different sort of community segments. Also, from the chief perspective and from the chief and council's perspective, if there is any way you can minimize or discourage travel, interprovincial travel, like currently, the risk is more from interprovincial travel rather than from international travel. So anyone, a majority of these 70 cases, and I'm sure it's no more 70, it's more than that now. Majority of these cases are also coming from interprovincial travel. So that's another caution we want to give people, that please, if it's not utterly essential, cancel the trip, stay home only with your vaccinated loved one, and protect them, protect yourself by, good masking, rapid antigen testing, using that, and just being aware and watching the environment, because anything that we're going to do in the new year, like if you are reopening school, certainly schools are expressing a lot of concern. This has been more than 2 years that the kids have a very disrupted learning, and no parents on this planet would want another troubling academic year for the kids. So we do want that by every means, we want to keep the school open and have all the safety precautions in place for the school activity, but also for extracurricular activities that happens after schools, so that you have steps in place to protect them. You are asking for proof of vaccination. You have vaccine available, and particularly we are very lucky that vaccine boosters are available for 18-year-olds and above. So please use that opportunity. And if you would want to have certain staff available during the holiday season, that in case somebody wants to get vaccinated or want a booster, so that that's available to them, or at least you can direct them or guide them to the nearest facility off reserve if they can go and get their vaccine shot, get rapid testing. I mean, in Regina, I went myself and in the library they were handing over rapid antigen tests, so I got a bunch of them, and I'm keeping it here. So if somebody's coming or we are hosting something, so that we can do that, use that. In every packet there are 5 sort of tests. So just taking those sort of precautions and just being vigilant, encouraging everybody to get their booster. And I don't know, Kelly, whether your clinics are off or closed, or whether there will be some availability of people can get access to the testing, masking, and also booster doses.
Yeah.
So that's all what I can say. And certainly you can use that message if you like it. You can certainly put that video message, which is under 1 minute. It's very quick and short, but it does speak about Omicron, what you need to do. So we sent that to all communities yesterday, and whoever want to use it can use it, or you can come up with your own message from the chief or from anyone like an elder can also record those messages and post it on Facebook. So that's all what I have, Chief, and back to you.
Thank you, Dr. Khan. And we did receive the video. I just want to let you know that, Dr. Khan. So thank you for always providing those positive messages and those real messages and up-to-date messages. I just want to know, I know there's only a selected few or a few on tonight that joined, but I just want to know, does anybody have any comments or questions? I do, but I don't want to be the first one out and the host, so I want to be respectful to others. Dr. Khan, there was one in the chat box asking if Omicron is getting very close to the First Nation yet. How about the region? Is there any confirmation of it in the region and then more closer to the First Nation?
I would say it's very close, or it's already there. So I don't want to give you an impression that it's far away and it will not happen, because we know every one of us, whether it's in the community or in a city, we go back and forth. So I know a lot of people come to Regina. A lot of people go to attend schools off reserve. A lot of people come for shopping. And there's a lot of undiagnosed, like even in the previous waves, we had in any given time, 3,000 to 4,000 cases undiagnosed in Saskatchewan. So there is a lot of undiagnosed, and people are mobile and moving in and out quite a lot for different reasons. This is a holiday season. A lot of people are going shopping. So the risks are there, and the risks are as close as you can think of. But the reality is that currently only international travelers are particularly screened. But just learning from Ontario, within a week, more than 50–60% of their cases are Omicron. So it's just a matter of time. We already have an evidence it's transmitting in the community, and Saskatoon and Regina have outbreaks declared in the school. So and none of those kids have traveled outside. So I think it's as close as you can think, and we should take every single precaution and multiple precautions. You just cannot stop the spread of this virus by just thinking, oh, I'm vaccinated and I'm safe. You have to use multiple sort of layers, masking, first of all, booster doses, masking, using discretion, minimizing travel, and getting tested, particularly if you think you are symptomatic or you come across to somebody that was traveling. So certainly those people are very meticulously investigated. They're close contacts who are coming from outside. The cases and their close contacts are very, very carefully monitored. So I would suggest it's as close as you can think. It's just a matter of time of that first test. I do have one community close to Regina. I called the chief on Sunday, and I did let the chief know that there was a close contact to an Omicron case from Regina. And actually, the exposure was in a healthcare setting. So I did let the chief know that it's a close contact. The test was offered. I haven't seen the results yet, but yeah, it's there already.
Thank you, Dr. Khan. There was something in the chat that was answered. I just wanted to bring it up because people are going to watch this video. It was asked, do the rapid test specify a positive Omicron variant? And the answer was that the rapid test will highlight that a COVID-19 positive is highly there, and to go and see a professional to get a
Yeah.
real test. So,
Yeah.
Dr. Khan, I sort of want to feed off of that. At what stage do you know it's the Omicron? Does it go to the lab from there, and then the lab will verify if it's the Omicron?
Yeah. So certainly, if your rapid antigen test come positive, certainly that would indicate that you should go for a PCR, and certainly nurse will get in touch with you if there was a risk of exposure from someone who was traveling or was already an Omicron case. So certainly there will be more sort of vigilance and monitoring on that we do do a PCR and find out if it's Omicron or not. So that's the current sort of process and procedure. But it is there already, and it's just a matter of time. So taking precautions is really critical. And using tests. I mean, you have plenty of rapid antigen tests. By just knowing you're positive certainly is an indication you should isolate yourself. And then in the meantime, the nurse will investigate. And as soon as I hear the first case or the second case, we will certainly let the chief know and let the family know and let that person know. So we will be watching that. And you know, so January we do expect a rapid surge in Omicron. In February, we are expecting our peak. And you know, if we have more than 200 cases diagnosed in Saskatchewan, I think we wouldn't be looking for any more evidence. I mean, we will still test and we will still find out, but I think the evidence is already there. It's a community widespread transmission, and the way it is happening in Ontario, within a very short period of time, it knocked out Delta. In the majority of jurisdictions where Omicron started circulating, within a week, it knocked out the Delta variant, and every case is considered an Omicron. So I think we haven't reached that state yet, but I think if we have hundreds and hundreds of Omicron cases, the way it transmits, majority of cases will be very quickly all Omicron. So I think with those sort of notion, I think we should behave and we should move in the community.
Thank you, Dr. Khan. I know Kelly, you had your hand up, but Kelly, go ahead.
Thanks. I just had, I guess, a couple of comments and questions. So just wanted to talk about what was happening with the rapid tests in our community. Just for everybody's information, is that they went out to the peacekeepers, and the peacekeepers are delivering them to every household this week. A lot of households already have rapid tests if you have kids in school, but those are going out, and I'm gonna touch base with Kevin after this just to see where they're at with those. Same thing for the medical masks. They did go out to anybody that we knew had a chronic condition, but we certainly have more, and they could also, I could take those down to the peacekeepers too, so that then they could just be available so that people could get them through the holidays. I guess I had a question about if we should be offering boosters through the holidays. I did have a conversation with Heidi, and we had kind of thought maybe not. We didn't have a very high uptake. And she also told me that she needs to have a second person there, but maybe once this video gets uploaded, then there'll be more interest, and maybe we should. I'm not sure. So I guess just looking for a little bit of direction on that. I think that's all I had to say.
So perhaps Laura is the best one to speak on this, but during the holidays, I think everybody would have one ear open or one eye open to watch. If there is a way you can measure the interest or request from people, and if 5 or 10 people want booster dose during the holidays, certainly that is something you can flag to the nurse or to us or to Kathy. I don't know whether Laura, whether we would have the ability to send a nurse during the holidays if there is significant interest or significant number of people want a booster, well, the local nurse is not available. I don't know what are the options there. I would let Laura speak to that.
Thanks, Dr. Khan. That's a really great question, Kelly. And I actually think there's some good thoughts there from Dr. Khan. You mean if you can gauge the interest, you may want to hold a clinic next week sometime between Christmas and New Year's. If you are seeing that there is interest, I definitely, from a staffing perspective, I would suggest you follow up with Kathy Miller at South Service Center. And if not, we do have some regional staff that might be available, but the process would be to go through Kathy to see what she has available and what's there. I appreciate, like you said, you've maybe had some lower uptake than you would have liked. Omicron might be that stimulus to get people out there, whether it's even a first, a second, or their booster dose. So if you can kind of keep it open to an opportunity, that would be great. If not, maybe it'll drive business up for the first week of January for you.
For sure. And I know that Heidi's available, but it's the having another nurse there. So anyways, but yeah, that's something I can kind of maybe put some feelers out there for.
Kelly, even if we open for one day during the 25th and the 31st,
Yeah,
I think that would be, and we could put it out on our however we get our communication, that, if say Wednesday the 29th, I just throwing it out there, something like that. Then that way, if anybody one day during and then we're open on the 3rd again. So I mean, it's literally 5 days after that.
right.
Dr.
For sure.
Khan, what is Omicron? Like, I heard that it's 10 times more transferable in the potency, that it's, can you just give us a little recap on what the Omicron is? I know it's in your video and stuff like that, but just for people watching, could you explain the Omicron and why it's different than the Delta and other COVID-19?
So, Chief, the thing that make Omicron a little bit different than Delta is the evidence that this particular variant has the ability to evade or to skip the immune response that is being launched or triggered by the vaccine we have. So currently, we were well protected by the vaccine if it was a Delta variant. So since there is so much changes in the genetic structure or the makeup of the spike protein, the way it binds with the human body or tissues or cells in the lungs, that particular change has made it escape the immune system. By the immune system, mean the mRNA vaccine actually help us produce antibodies that actually protect us from this virus attacking our cells. So that antibody, before the virus attacks the body cells or the cells in the lungs, which really, that is the main sort of route of entry to the body, that actually immune system is heavily compromised by the changes in the Omicron. So Omicron seems to be very much able or stronger than the Delta in terms of tackling those antibodies that are being produced by the vaccine, but also it can still invade the cells and cause the disease that it is supposed to cause. So with that sort of compromising the immunity in the human body, from the second dose, if you would recall, we were saying that you should have 6 months because, first of all, from the second dose, it takes that time to develop that optimal immunity, but also immunity also cannot last longer for more than that time than the 6 months. So that's why the idea of a booster dose, which kind of refresh the immune system and rejuvenate the immune system to produce and to be more robust to fight the Omicron virus. So the idea of booster. So if so currently just to fight the virus more quickly and more readily, that time interval between the second dose and the booster dose was initially thought 6 months, but now that was reduced because we want to protect people. And the fact that after the second dose, if you get your booster dose within 3 months or after 3 months, you would still have a very, like the evidence says that you still have 70% of immunity with a booster. So 70% of immunity with a booster is quite a good immunity to protect you from that severe illness and hospitalization. And the other unique thing about this Omicron is that we are seeing more and more reinfection because of the same phenomena and because of the same reason. We are seeing more and more reinfections among the people who are double vaccinated. So that's why the idea, we are repeating the idea again and again so that people can get the booster dose. And by booster dose, you kind of refresh that immunity to fight the virus. So that is a very distinct feature of this virus, which we haven't seen with Delta or with any previous variant, and that is the reason that that is perhaps the only way we can fight this virus, by getting our booster shot. Plus, because the risk of reinfection is very high, because the immunity declined very quickly, particularly to fight this virus, you need to have a very strong immunity and very refreshed and robust immunity. And that happens after the booster dose. Now, we don't know that after the booster dose, that is still unknown, how long this boosted immunity would last. That is unknown. So, but at least it protects you from 3 to 6 months till we find out more. Also, both Pfizer and Moderna. So first of all, the research has shown that both mRNA, no matter whatever primary series you had, if you had AstraZeneca or Johnson & Johnson, whatever your primary series was, the best robust immunity come from a booster with mRNA vaccine. Also, both Moderna and Pfizer already have started the process for a tweaked vaccine that would target particularly Omicron in the new year. But by the time that Omicron tweaked vaccine is available, that will be April or June next year. So before we get there, I think we have to protect people in the holiday season because it's winter, people are congregating, and the best way is to protect them by a booster, masking, and these multiple layers. And certainly the evidence is changing. In January, we will have more community level data. Certainly all this data we are talking about is coming from the lab-based studies. So certainly we would know more, like South Africa, UK. These are the countries that are advanced ahead of us in many, many ways. So by January, certainly we'll have more population-based data or evidence how this Omicron behaves in a population which is already infected by the virus and recovered. So this is what the situation in South Africa is, that more than 70% of people have the immunity from the virus by natural infection. They didn't have the vaccine, but everybody got COVID, and from repeated COVID exposure, they had this immunity that actually helped them fight, and that is perhaps the reason they don't have many severe cases. But comparing South Africa to UK, which is high vaccination rate, is Canada or Saskatchewan, the real impact of Omicron in a population which has high level of vaccine rates or uptake is certainly something we want to watch. So UK hospitals are filling up, but they're filling up because people are not observing precautions. They are re-exposed, reinfected, and not everybody can lodge effective immune response because everybody immune status, everybody age, everybody multiple conditions are different. So that's why hospitals may fill up, So the key attempt here is to protect hospitals for those who are really needing the hospital. And if by January and February we find out that this Omicron caused infections or reinfections, but is not severe, then certainly that will change the whole landscape. But for now, there is all sort of risk and threats available to help us understand how this virus is going to behave. But certainly with the time, we expect more knowledge, more evidence, and more scientific findings on how this is going to behave in a community or in a country which has very poor access to vaccine compared to those who has a very high uptake of vaccine. And certainly in our indigenous communities, everybody is very high risk. And everybody live in a very overcrowded setting. So that risk of repeated exposure is very high. And also we have a lot of elderly population, which even with the booster doses would not be able to launch in any individual an optimal immune response. So for that reason, we need to take every step to protect people.
Thank you, Dr. Khan. And I just wanted to mention that Genevieve put in the chat that that we know the booster is effective to decrease severity of the illness of Omicron, and just shared some other information in there. I wanted to kind of wrap it up soon, but I just wanted to share one thing and then see if there's any more questions from the ones on. But I just want to let you know what Cowessess is doing. We made a very strong stance with our employees, and the response has been quite well. Every one of our employees and our entity employees have got the vaccinations, are in the process of getting the booster, just to minimize the risk around the work environment. Secondly, masks are mandatory in our public settings, and we've been sanitizing as best we can and offering all that. We've offered kits to all of our homes now, and in our staff that are working close to clients and to community members have to do the COVID rapid test twice a week minimum, and so forth. And then every staff member that comes back to work after the holidays must show a rapid test negative prior to coming back into work. And we're going to do a soft opening the first week back, because our patterns have shown that New Year's last year was when we got our first COVID positive, and it was most likely because of the shopping and the family gatherings. And then again at Thanksgiving in October, our cases went up again, spiked, and we got back to zero. We're zero as of this hour. Dr. Khan, if you can just start to close, but can you give some tips during the holiday season? Unfortunately, people are shopping. I don't say that unfortunately, but realistically, people are shopping. We're not going to act like everybody's safe at home right now. And people are going to gather. They're going to have turkey. They're going to have food. They're going to play cards. They're going to play games. And, as much as we say we shouldn't do that, realistically, people are. Can you give us tips, Dr. Khan, while these are happening, just things we can minimize the risk as we get through this holiday season, maintaining some kind of relationship with our families, but realizing we're in a pandemic?
Yeah, Chief, that's very important. And I know families are important. Family members watching, looking after our family members, elderly, is very, very important. And I think that has to happen. I mean, looking after each other, caring for each other, and expressing your love in this time is really important. And and there is no doubt about that. People have to show that, and people have to do that. But there are many ways people can still be safe and protect themselves. So first of all, get your shopping done in a very sort of safe way. Wear a mask, a well-fitted mask, medical mask, if you are going for shopping, and minimize people if you can. If one person can do your shopping, that's great. And while you're shopping, keep distance from people. And after shopping, you come home, put the grocery or shopping in the car, wipe off your hands, and those sort of things. And if you're planning a gathering or a dinner at home or in your family members, you certainly have an option to have a rapid test done as closely as you can to the party you're hosting. First of all, about a party or gathering, that minimize, restrict, or limit your gathering to people who are vaccinated and who are your close people, and you know about their status. And also, you can offer them tests, or they can get tested just before before they join your dinner. So that will certainly screen people out who are positive or who may be at risk. Particularly if you are having elders on the table and you want to serve them, that is great. Please do that. But being respectful and be also mindful that we all want to protect our elders. We have lost many, many precious lives and elders, knowledge keepers, and we have lost so much of wisdom and knowledge through that. So their lives, their presence, and their companionship is very critical for us, and we want to protect them. So if you are having an elderly couple or a family or an aunt or a grandfather, please protect them by, first of all, getting yourself or your guests tested, or you can get them tested as well. Also, you can certainly offer them a booster, plan it. You can talk to the nurse. If you live in close to town where the vaccines are available, please do that. Other than that, ventilation is a very important sort of dimension that came particularly very loudly in the light of Omicron. That, you know, if there's a way you can, before people come or after people leave, that you can cross air, have a fresh air. I don't want to expose you to extra cold temperature, but if there is a way you can expedite your ventilation or keep an window open for fresh cross air, that's great. Minimize the gathering, offer the food and enjoy the food and music or whatever you want to plan. So that is at a little bit of the family level. At the community level, gathering certainly, funerals, a lot of these life and death events happen. And in those events, certainly only close people, only close family members, with the masking, with the distancing, and those sort of things that you have been doing all along. So certainly those were good habits and have protected everyone. Yeah, just those sort of basic tips and basic principle. And if somebody's symptomatic, I know it sounds very rude, but if somebody's symptomatic, we would suggest that they stay home and maybe connect virtually. If there is a way, can be connected or can be part of the family sort of gathering, certainly there will be ways. But just being mindful, and same sort of phenomena or philosophy or principle can be applied at any sort of gathering in the community or outside the community. And particularly as we reference the interprovincial travel is very high risk these days. A lot of provinces have very dramatically scaled back their openness or their openings, restaurants and movie theaters. And those sort of things. So basically the same principle: wear a mask, keep a distance, and less the handshake. And I'm sorry to say this, handshake is part of the culture. But as we have learned, the virus moves with us. Wherever we go and touch and move, the virus moves with us. So that would be something we need to be mindful. So that's all what comes to mind, Chief. And I know everybody has their own lesson learned, and they can certainly apply that as well.
For sure. Well, thank you, Dr. Khan. You know, this is going on month 22 right now, or maybe I lost track a little bit, but where this has become a norm and tiring and fatigue. But I think this one is one of very big caution. So I thank you, Dr. Khan, for sharing some insight, as well as Genevieve and everybody else. We will be posting this to how to get our communication to our citizens, both off and on reserve. Dr. Khan, we're going to get through this in the next couple of weeks here and get back to the grind after a little bit of break. But I hope that we can all, just take some time to rest and to prepare for the unknown in January. And let's hope all of our actions can show that we can get through this current variant, as well as to the end goal of remaining low risk. So I thank you, Dr. Khan and Genevieve and everybody else and the ones that joined. Thank you very much. And thank you, Kelly, for setting this all up. Kelly, you'll post if we're going to open one day next week between Christmas and New Year's, if we can get some booster shots out, or even some first or second COVID shots as well. The more, the better. But anyways, we're 0 as of this hour on the reserve, and everybody off the reserve, I hope you're safe, and thank you everybody for participating. But we'll end this meeting with, stay safe, enjoy your days off, and we'll get back to the grind in 2022. So thank you.
Thank
all.
Thank you so much. Merry Christmas, everyone. Stay safe.
Bye.
Christmas.
Merry Christmas.
Bye.